Welcome back, everybody. Listen, if you are not happy with the smile you present to the world, you don't have to live with it. You can fix it. Cosmetic dentist Dr. Todd Shatkin from the Aesthetic Associates is back with what can be done in no time at all with today's modern procedures, including a dental implant procedure, which this man has invented himself. So good morning and welcome back.
Good morning, Linda. Thank you. It's always great to be here.
Oh, you always bring us interesting pictures because those pictures represent so many different people out there who say, well, I don't know if he can fix my problem.
Right.
And then you see the picture and say, wow, I guess he can.
That's what we try to do. We try to show what we can do for people and help them. You talked about Ivy League construction, putting smiles on people's faces. Well, I'll try to put the smile on their face before they call him. Okay, fabulous. All right, let's look at some of the befores and afters, and we can see what you're talking about and what can be done. Okay, so this gentleman had a congenitally missing tooth, had braces on to move the teeth and straighten them all out and align them. And then once he was completing his orthodontic care, we put the implant in, and there it is with the implant in place. Ooh. And then we sent him back to his orthodontist, and they took the braces off, and so here he is with his braces off and his permanent tooth in place. That's just amazing, the difference from someone who had that gap there into this. I mean, you know, it's just one of those things where I think when you let something like that go, unfortunately, you know, when you're out looking for a job, people are making observations about people. You know what I'm saying? And sometimes, you know, you can only afford to make that first impression once. Well, what's so nice about that case is a young boy. He's a teenager, and what was nice about it is that when he got his braces off, he had something in there right away. Right. When they have the braces on, they put a bonded tooth in temporarily. But this way, when he got the braces off, he could get the tooth immediately. I wonder how many people think it was just the braces that closed the gap. Exactly. You never know. That's amazing. And you know what? And that happened in no time at all. I mean, really. Yeah, it was done in one visit, one treatment visit, and it was coordinated with the orthodontist all, you know, in advance, so that the day after we put the implant in, he went back and got his braces off, and it's good to go. All right, let's see another case, because I think we have more pictures. Yeah. And now this is what I call the Michael Strahan look, or Madonna, but not everybody likes the gap in the middle, okay? You don't have to live with that. Right. So this particular patient had actually a missing tooth as well, but what happened is I see it on the right. This patient did not have braces, so the teeth spread out, and he was missing the lateral. And so here's the before picture, and you see the cuspid there. We didn't have enough room to put a full tooth in there, so we did porcelain veneers across the front 4 teeth and closed up the space and reshaped the teeth to make them all just a little bit bigger, so that we spread the space out evenly among the 4 teeth. Oh my gosh, and look at the difference from the before and after. Yeah. That's amazing. He was obviously thrilled with that result. I can imagine. And that was done in 2 visits. And let me also talk about this too. You're never too old to have something like this done. Don't ever think, well, I'm so-and-so years old and, you know, I shouldn't expect. You should expect to have a beautiful mouth for your entire life. Absolutely, and if for some reason you haven't had it for your entire life, treat yourself at an older age to make it look good so that you can enjoy the rest of your life. Because as we talked about before, what you do is, as far as your dental health and your oral health, you may not think it's a big deal, or maybe I don't want to spend the money, but you know what? You're also such a role model for your children and your grandchildren that if you're not getting this done, you're sending a subliminal message that oral health isn't important. That's not true. Absolutely true. And also, you know, when you smile more, there's studies that actually show that you're happier. And if you don't smile so much because you're embarrassed about your smile, you may not realize it, but you're really not going to be as happy as if you smile more. Plus, look at how many people are starting new careers halfway through their life. By all means, you want to make that first step forward a good one. You want to be able to smile. You want to be able to show the world, this is how I feel about myself. And taking pride in that really takes so much less money and so much less time than you think. And certainly we're at the point now where it's pretty much a painless procedure. Yeah, it'll be very painless for the patient, and painless also in your pocketbook, because we offer interest-free financing up to 2 years, and if you need more time, we can even spread it out longer. So. And there's virtually no case that you haven't seen by this point in your career. Pretty much. And you know, people come in the office and they say, oh, I don't even want to show you my mouth. It's the worst you've ever seen. And 9 times out of 10, they'll open their mouth and say, no, I've seen worse. Occasionally, you know, it's really bad, but truthfully, even though you might think this is the worst thing, you know, you can imagine, As dentists, we see this stuff every day, so it's really not a big deal.
And you know, the whole nice thing is that once you do see it and you start making the corrections, everything else gets taken care of down the line as well. Your whole entire oral health starts to improve, because now you do start going back to the dentist.
And when your oral health improves, your physical health improves,
yes.
because that's a well-known fact that the bacteria in your mouth and your gums can get into your bloodstream, cause all kinds of medical conditions.
Not only that, but like you say, you're not happy. If you have spent a lifetime of avoiding smiling, avoiding pictures because you hate the way your smile looks, that's just not something that you have to live with anymore. That you're thinking about something 50 years ago.
Absolutely.
Where, oh, I went to the dentist once and it was painful, or I know that there's nothing they can do for this, or I had a tooth knocked out when I was a kid and I've lived with it. You don't have to live with any of these things anymore. You really don't.
Well, I got a text this morning from a friend of mine, I won't mention name, but he's texted me 4 or 5 times over the years saying, I need to get my teeth fixed, I need to come in. And I keep saying, make an appointment, make an appointment. But he's really scared. And I keep saying, you know, it is painless now. We can, if you're really, really anxious like he is, we'll give you a sedation. We have an anesthesiologist who'll give you a shot in the arm. We'll sedate you for, you know, whatever time it takes to, you know, complete the procedure. So we do sedation dentistry.
Yeah, it may not be in the title, but you sure do it.
Right.
Right. And also we want to let people know, if you have been living with dentures, don't you know that they have a wonderful procedure now that can actually help replace the palate, so that it's your own palate again. You don't have to have all of that plastic in there anymore.
Right, you can have a palate-free denture or even a complete implanted bridge without any removing at all. So it can be a permanent bridge work, permanent denture, or whatever they like.
Right, so you know, let the family know that, look, I think it's time, I want to get something done. You'd be surprised. I would bet you probably get a lot of support from your family saying, yeah, we'll even help you with this. Because if that's something that you've always wanted to have done, mom or dad or grandma, you deserve to have a beautiful smile. And in this case, it could be a son or a grandson, as you see the difference here.
Right.
And sometimes through no fault of anybody's own. Like you say, some people are born without certain teeth. It's not even like you didn't take care of them or they got knocked out. They just weren't there by birth. You know?
And these are we do the mini implants, which is much less invasive. It's less time consuming. It can be done in 1 or 2 short visits, and it's less than half the cost of the older style implants. So we're able to get it all done very quickly, affordably, and without any discomfort.
So by all means, we hope we have talked you into making that appointment, because there's certainly no reason why you haven't or you can't. The Aesthetic Associates Center waiting for you. You can give them a call at 839-1700. You can also go to their website, gr8look.com, and see what Dr. Todd Shatkin can do for you. All right. With that, we'll give you some time to write that number down. We'll take a break, and we'll do more when we come back.